Managing healthcare expense. This is the general concept that includes all of the strategies and tools you can use to manage your medical expenses. It's involved understanding your health insurance policy, figured out how to reduce medical expenses, and making plans for unexpected medical emergencies. Addressing the financial burden of illness or injury. Being ill or hurt can cause stress on one's body as well as finances. This section looks at a strategy for handling the significant costs related to medical care, medication on prescription, and possible mis-earning while recovering. Source of protection from direct medical care costs. The various ways you can avoid having to pay the full price for your medical bills are referred to as a source of protections against direct medical care costs. This could be financial instrument or incentive that assist with part of the expenses. Why it is important? Number one is financial stability. Protection source assists you in controlling medical expenses without compromising your financial security. Number two is peace of mind. Being able to concentrate on recovering rather than worrying about massive medical expenses is made possible by knowing you have some protection. Health Maintenance Organization. A type of managed care health insurance plan called an HMO places a strong emphasis on being healthy and having preventative care. Generally speaking, they have a certain trade-off but offer cheaper monthly rates than other plans. A type of health insurance plan known as Customer-Driven Healthcare or CDHC gives the customer more control over how much they spend on medical care. To determine if CDHC is the best fit for you, you need to take into account your health needs, financial status, and risk tolerance.
Making sense of your medical plan benefits. You can save yourself considerable confusion, delay, and money if you understand your health plan benefits before illness or injury strikes. If you have a group plan, you will receive a certificate of insurance that outlines your benefits. So, ayun po, makakatanggap din po pala tayo ng benefits if may mangyari sa ating na aksidente, injury, may malubha tayong sakit, ay makakatanggap din po tayo ng benefits na galing sa health insurance. And depende po yun sa company kung magkano po yung bibigay sa atin. Okay? Sa what types of care are covered? So, ayun po, babasahin ko po. The typical medical care plan covers hospital room and board expenses, surgical procedures, both as an inpatient and outpatient, prescription drugs, diagnostic tests, visits to the doctor's office, and many prospects of healthcare. So, nakapaloob po dito sa care plan natin ay ang hospital room. Depende kung saang hospital. Surgical procedure, kung may malubha ka sakit at kailangan ka ng operahan. Prescription drugs, kung ano po yung gamot na iti-take po natin. Okay. Nandiyan po, nakapaloob din po yung sa health insurance at wala rin po kayong babayaran kahit na. Okay. Who is covered? Medical care plans can be written to cover an individual, a family, or a group. Few misunderstanding arise when an individual is the purpose of the coverage, but family politics can be more complex. Generally, a family consists of a parent or parents and independent children. Okay? So, pwede rin pala tayong sa isang health insurance po natin, pwede rin palang magamit sa ibang terms. Halimbawa is may pamangkin ako, may health insurance ako. So, may yung pamangkin ko na yun, may sakit, may malubhang sakit, kailangan sa operahan, kailangan niya ng gamot. So, ayan. Pwede ko rin siyang magamit doon sa pamangkin ko para iwas din po sa bayarin, iwas din po sa pambili ng gamot. Yan po yung tinatawag ng health insurance. Okay?
Thank you, Mr. Tejada. Who is covered? In most cases, children born while the plan is in effect are typically covered from the moment of birth. Stepchildren may also be covered under certain circumstances depending on the specific term of the insurance policy. Coverage for children usually ends at a specified age, which is often around 26-year-old, but this can vary depending on the insurance provider and the policy terms. It's essential to review the policy details to understand the exact coverage for children and stepchildren under the medical care plan. When does coverage begin and end? Typically, if someone is already hospitalized when their insurance plan expires, the coverage will usually continue until they are discharged. In the case of surgical procedure performed after the plan expires, for an illness or injury that was initially treated during the plan period, it may still be covered under certain circumstances. It's essential to carefully review the terms and conditions of the specific insurance policy to understand the coverage continuation in such situations. Planning for long-term care. Number 1. Degree of impairment. Insurers use the inability to perform a set number of activities of daily living, or ADLS, to determine when the benefits start. Number 2 is level of care covered. Nursing home care categories include skilled nursing, intermediate care, and custodial care. Number 3 is person age. Premiums are lower when purchased at a younger age due to increased likelihood of needing care as one age. Number 4, benefit amount. Policies provide a specific dollar benefit per day with different benefit periods. Number 5, waiting period. Policies can include a waiting period affecting when benefits start and premium cost. The last is 6, implementation protections. Policies may offer implementation adjustment to prevent. And lastly, protecting your income during disability. Sick pay benefits and group disability income insurance can help during short-term disability. Pension plans may offer benefits for disabled workers, but they may not fully meet the needs of younger employees. Disability income insurance is essential for replacing lost income due to illness or injury. Social Security disability. Income insurance provides benefits to eligible disabled workers with a waiting period and specific eligibility criteria. And that's all. Thank you for your listening.
Thank you.